you guys can have this nice, short, sweet webinar, 30 minutes. You guys can have the recording, share it with your friends who are also getting ready to sit for their boards and asking the exact same questions. And that way, you guys can really get the breakdown of the two different board certification exams and feel confident in the one that you pick. So hopefully that will help you today. That is my goal for today's webinar. Before we get started, if you guys have attended Archer's webinars in the past, you know that we are accredited by the ANCC, American Nurses Credentialing Center, for continuing education credits. This webinar in particular will not have a C attached to it just because this is a short and sweet, let's go over the overview of the two board certification exams. But I just wanted to bring this to your attention because our free webinars that are an hour long are eligible for the CEs if you participate through our Zoom account. So definitely make sure you're keeping an eye out for that. I know Morgan just did an awesome respiratory webinar this week. The webinars do live in our Facebook group, which is private, so you guys can always join our Facebook group, and I will give you a little QR code at the end of this presentation so you can go straight there. If you're not a Facebook person, they also live on our YouTube channel, but our Facebook group is a really nice way to really connect with our community because it's a lot of not just new nurse practitioners, but also experienced nurse practitioners, and everyone's sharing a lot of tips about jobs and what states to practice in and clinical pearls. So it's really nice. And Annie does a really great job of posting a lot of great clinical questions just to keep us all up to date and continue that lifelong learning as well as we finish our training and enter our clinical practice. So make sure you join our group and make sure you join our webinars for those continuing education credits. But today we're just going to really be going over the overview. So no CEs attached to today's webinar. So just kick back, relax, and make sure that you participate in the Slido account. I'll have that up and running for us in just a minute. The other thing I wanted to disclose is that I have no financial relationships to either of these board certification exams. So this is really just my personal overview of the two certification exams. It's what I tell my students when they're asking me which ones that should they take. I do not favor one over the other. I'm just going to give you an unbiased view of the two board certification exams, their similarities and their differences. But I have no commercial interest or financial relationship in either one. So I just wanted to make sure that you guys understood that. All right, so for those of you who have participated in my webinars before, you know I love Slido, and Slido is a really fun interactive tool where we can participate together. I know a lot of you, some of you are joining us from Zoom, some of you are joining us on Facebook and YouTube, so there are a lot of different streaming avenues for these webinars. Slido is a really nice way for us to be on the same platform so that we can see each other's responses. It is totally anonymous. So when you do respond, nobody can see your name unless you want them to. You can always allow that feature, but it's totally anonymous. So it's a really fun way for all of us to interact. And I like to know who's in my audience so that I can really tailor my presentation to you. So just like I do with my one-on-one tutoring and mentoring, I like to get to know you so that I can really customize and tailor my presentation and the knowledge that I'm dispensing today to your particular needs. So go ahead and scan this QR code. If you've joined Slido before, you know you can join by scanning a QR code. Or if you can't do that, you can also go to slido.com and put in this hashtag NPCert. And then that'll bring you to the first poll that's up and running. And I just want to know, where are you guys joining from? Who's in the audience today? Like I said, I'm here in Texas. I'm in North Texas. I'm not originally a Texan, but I've been here for enough years that I feel like a Texan. But I'm originally from the Northeast, from the Boston area. We've moved around a lot, myself and my husband with our kiddos, and we've settled now here in Texas. My husband is a native Texan, and my kids are now third generation Texans. So who knew growing up in Boston that I'd land in the Southwest? But it's really lovely, and typically we get a really hot summer, but this June has been pretty mild. So I'm really grateful for the rain today, and it's feeling really nice out there. So tell me, where are you joining from? Who's in the audience? I want to know, are you an RN just starting in your NP training? Are you just thinking about NP school? Are you getting ready to graduate NP school and you really want to know which board certification should I take? Have you already taken your boards? You're thinking about entering clinical practice, or you're starting to enter clinical practice. I want to get to know a little bit more about you guys. So where are you joining from and who's in the audience? So I see Patricia from Connecticut. Welcome. And then I also see Malin. Hi, Malin from North Carolina. So good to see you. I know Malin well. And then we have students from Florida and Pakistan, students also retaking the exam, and DNP finishing your FNP and psych mental health. That's awesome. So we're seeing that a lot, right? We're seeing in the primary care space a lot more psych mental health is falling onto those primary care clinicians just because of access to healthcare. So a lot of students now are getting dual certified with their FNP and their psych mental health. So good for you. That is awesome. And you're almost finishing. So you're getting ready to really cross that finish line and enter your clinical practice. So kudos to you. That's a huge accomplishment. I also see Pakistan and DC. Mara from Puerto Rico. Wow, a lot of people international today. That's so nice. A couple people from Pakistan, or maybe it's the same person trying to participate. Either way, that's really cool. Love to see you guys. And it sounds like we have some people retaking the exam and some people maybe finishing and starting to think about taking the exam. Very, very good. So now I just want to know, how long have you been in nursing? Are you a new nurse, less than a year, 1 to 2 years, 2 to 5 years, 5+ years? Most of the programs, the nurse practitioner programs, require that you have some training or some nursing experience. But now we're also seeing a lot more direct entry programs as well. So I just want to know, where are you in your nursing journey? How long have you been a nurse? So I see a couple of you putting in your responses. I couldn't get our Instagram to work today, which was a bummer. So I really wanted to make sure that everybody got this lecture, but while you guys are putting your response, I'm going to try one more time. No, it won't let me. That's a shame. Oh, and I see some people again, Florida, DNP. Took the exams. I'm here because I like the content. Oh, very nice to see you, Michelin. That's very nice. So it looks like most of you are in that experience range. Look at that, 5+ years in nursing. That's wonderful. A couple of you in the 1 to 2 years, a couple of you in that 2 to 5 years. So getting to your 5-year mark, that's really, really great. I love to see that because we really need more nurses going into advanced practice. There's a huge gap in providers, especially primary care providers in our healthcare system, and that gap's only going to widen. And nurses bring so much knowledge and so much value to our healthcare system. And I really, that is one of my biggest passions. That's why I love working here at Archer, because we really advocate for nurses and knowing your value going into your roles in the healthcare system. So I love to see that. That's awesome. Very, very nice. And then the last fun poll before we get into the content, where are you in your nursing journey? I kind of asked that and I forgot I put this poll in there, but you guys can go ahead and put it in there again. So I saw a couple of you in the DNP, couple of you retesting. We can kind of skip over this one and get into the content. How about that? All right, you guys. So let's go over the AANP and ANCC overview. I like to look at everything side by side. That's the way my brain works. So that's kind of how I put it together for you guys today. Hopefully you find that helpful as well, but let's break it down. So we have the two main board certification bodies. We have the ANP and ANCC. Let's go through the ANP. So exam layout, they typically give you about 150 multiple choice questions. These are usually just one single response. 15 of those 150 are unscored, but you don't know which 15. So oftentimes I'll hear students telling each other, oh, it's usually the first 15 or the last 15, so I don't answer those. So I really want you to understand that they really sprinkle them in, and there's no rhyme or reason of the first 15, last 15. So every question that you get I want you to take it seriously when you're taking your board certification exam. It could be the real thing, right? And you don't want that to count against your score. You get about 3 hours time limit for that 150 multiple choice questions. Now, on the other end, the ANCC, their exam layout is a little bit different. They have about 175 questions, and the formatting can really vary. They've got multiple choice, multiple response, drag and drop, hotspots. Hotspots are when you click on specific locations in a diagram or image to answer the question, and you get about 3.5 hours time limit for the ANCC. Now, the scoring is also different. Before I go into the scoring, I also get my students getting really hung up on scoring, especially those who are retesting. And I want to make sure you guys understand that just because you're retesting doesn't mean that you're going to be an inadequate nurse practitioner or it says something about you. This is just an exam, right? This is just a board certification. And so we just have to get you past this hurdle, and you are a qualified clinician. You're going to get into clinical practice and really make some wonderful, meaningful impact for your patients' lives. So I don't want you to get so caught up in that scoring and what your score comes back at with. It's kind of hard to do, especially with the AANP, because you do get a score report. And the score report, if you fail, is helpful because it can really help you identify those knowledge gaps and go back and study in those knowledge gaps. But the score itself, I don't want you to get so hung up on it because I want you to pass with flying colors. I don't want you guys just to be borderline and just barely squeaking by, because that doesn't really feel good going into clinical practice with that in the back of your mind, right? I know it would eat away at me. So I want you guys to really feel confident entering your clinical practice, but know that the scoring scale for AANP is passing score above 500 and the scoring scale for ANCC passing score above 350. Now with the ANCC, you only get a report if you do not pass the exam. With the AANP, it does give you that report and it's really helpful. And I'll show you what that those domains are. But with the AANP, the 4 domains are assessment, diagnosis, plan, and evaluation. And so it'll give you a report of where you scored best and where you scored the least, the worst, I guess you could say. And so that's really helpful, especially for those retesters in the audience today, because then you can really go back, especially with our question bank. We also identify which questions fall into these domains. And it's really nice to filter through those domains and just beef up the domains that you really need more help with. So it's nice to get that score report back. ANCC only gives you a report if you did fail, and their domains are a little bit different. So they also have those 4 domains of assessment, diagnosis, planning, and evaluation, but they have an extra assessment. They have an extra domain called implementation. And so if you look, implementation for ANCC is that biggest bucket. So I also put the percentages here for you guys. For the AANP, it's pretty much evenly distributed. It's a little bit heavier in that assessment. So they want to make sure that you're able to make an accurate assessment when you see a patient and then get to the right diagnosis and plan. And then you're going to see them for follow-up, right? So they're really emphasizing that assessment bucket and then kind of evenly distributed around the diagnosis and plan, and then with the evaluation, the follow-up. And then with the domains of the ANCC, that implementation bucket is the biggest bucket. And we'll talk about that in just a minute. And you'll see the other buckets are kind of evenly distributed. So what is that implementation bucket? What does that mean, right? And that's going to be how you're really going to decide the difference between whether you're taking AANP or ANCC. You've probably heard rumors that like AANP is more clinically focused and ANCC is more focused on those professionals going into more administrative roles. And so the reason for those rumors is because that implementation bucket, which is about 30% of their questions they estimate, and all those numbers really come from both the AANP and ANCC websites directly. But that implementation bucket for ANCC is really this is how they've listed it out. So legal and ethical implications for healthcare and technology. So they may ask you questions about HIPAA, confidentiality, accessibility. They also want to ask you questions about non-pharmacologic interventions and treatment options. So they might ask you questions about different procedures like splinting, biopsy, suturing. They might ask you imaging questions. Remember those hotspot type style formatted questions. And then they're also going to ask you pharmacotherapeutic interventions. So they'll want to know side effects, adverse effects. They want to make sure, remember, in my pharmacology lectures, I always say safety first when you're thinking about pharmacology, safety first. And that's probably what they're going to get at when they're asking you those questions on the board certification. And then you have your regulatory guidelines and your scope of standard of advanced practice. So all of that is what falls into that implementation bucket. And that's why ANCC has the reputation that it does, that it's more for the professionals who want to go into those administrative roles. Now, I am certified through ANCC and I went the clinical route. So it doesn't mean that if you do sit for the ANCC, you're not going to be board certified for the clinical route. They're both board certifications and they're both seen equally. And then the last thing I wanted to show you guys was the age distribution. So ANCC doesn't list they didn't publish their specific age group distribution by percentages, just AANP does. But I kind of wanted to show you guys the two exams and how they list them out. It's pretty similar. They just call them something slightly different. But one exam just groups all the newborn and infant together under infants, and one exam breaks it down. The other one does toddler and child, and the other one does children and groups it together. They both have adolescent, they both have adult. One of them just breaks down the adult to young, middle, and older adult, whereas the other one does adult, old adult, frail adult. Overall, I've kind of grouped the percentages here. You'll see that it's really evenly distributed among pediatrics, young adult, middle adult, and old adult, with a little bit more weight on the older adult. And this is for both exams. And the reason for that, the key takeaway is that they're really emphasizing that adult and geriatric patient population because both board certifications strongly emphasize that they really want to reflect the population most commonly seen in primary care practice settings. So that's what I want you to think about as you're doing your practice questions. You really want to make sure that you're feeling comfortable with the typical patients that you're going to see in that primary care setting. And that's really going to be a strong emphasis on adult and geriatrics with also knowledge of those pediatric patients and those milestones, those developmental stages and milestones and how to manage all of that. So that's really important. So here, the last slide, I'm just going to do a quick overview of what the credentialing looks like for AANP. So AANP overview, it's the American Academy of Nurse Practitioners. Your credentialing will look like FNP-C. And then for the renewal for ANP, you'll renew every 5 years. The requirements are 1,000 hours in one or more of these buckets. So either 1,000 hours in patient care, other 1,000 hours in administration or education, plus your mandatory 100 hours of CE. And then for the ANCC, that's the American Nurses Credentialing Center. They are part of the ANA, so that's something to note. The reason for that is as you're also looking at these two different board certifications, you want to really be thinking about what do you want long-term in terms of a membership. So both certifying bodies, you will be getting a membership when you're certifying every 5 years as well. You'll be paying through a membership. And that membership will give you discounts for their conferences, their continuing education that they offer. They also offer free continuing education for members. So it's good to be thinking long-term about which community makes more sense for you to be a part of long-term. Which ones do you like to attend those conferences? Which CEs do you enjoy more or prefer more in terms of format or offering? So I want you to do a little bit playing around on their website just to make sure that whichever one you go with, it's more for long-term. It's not just for the short-term passing your boards and becoming certified. It's more about community and which community do you want to join long-term. So ANCC is part of the ANA, that's the community, and then the credentialing is going to be FNP-BC, and that's what you'll see at the end of my name too, because I am credentialed with the ANCC or by ANCC. The renewal is the same every 5 years, lots of different renewal options for ANCC. So again, same buckets with patient care, administration, education. They also give you the option of doing additional CE hours if you don't have enough hours in those buckets. So again, I think why it steers a little bit more towards the professional role and administration in the hospital system, or traditionally it has. And then the mandatory CEs are about 75 hours for those 5 years. Now, for those, since we do have some retesters in the audience, I don't want you to fixate on this, but know your retesting options for both, right? It's good to know that the ANCC, you do have to wait 60 days if you fail, and then you'll have to apply to retest online, but you can have 3 attempts a year. And then going back to the AANP, their retesting options are you have to get 15 CEs. Typically, it does have to be related to the subjects that your exam score report areas were weakest in. And then you have 2 attempts a year to retest for the AANP. So that's also just something to know for those retesters in the audience. All right, you guys. So biggest key thing here is really choose the community that's going to help you stay involved and continue your education lifelong, because in healthcare, it's always changing. Guidelines are always getting updated. We really need to stay clinically relevant to be practicing safe, evidence-based medicine. So when you're choosing your board certification, you saw the breakdown between the two, but you'll see that there's a lot of overlap, a lot of similarities. So really, you can't go wrong with either one, but really go with your gut and see which one is the community that you want to be a part of long term. And that's going to be the best fit. It's really not going to impede your job prospects down the line. I know that's something when I was a new grad, I was really worried, oh, which one should I take? Because I want to make sure that X, Y, and Z settings will hire me. It's really not the case, especially in our healthcare system where we need more and more clinicians. We do not care which board certifying body you have been credentialed by. Being on the hiring end now, when I see a resume, I don't favor one board certifying body over the other. I just want to know that you're board certified, you're up to date, you're clinically relevant, and you're going to be practicing safe, evidence-based medicine. And that's the person I want in that seat for my clinic. So just be mindful of the community and really go with the community that makes the most sense for you. Speaking of community, here is that QR code for the Archer NP community. Like I said, all our webinars are in our Facebook community, along with the great content that Annie posts. And it's just a really nice community to really continue to inform each other about jobs, about salaries, about states that are NP friendly, a lot of NP entrepreneurs now, and giving each other tips about starting your own clinical practice, starting your own telemedicine practice. Our very own Morgan Boosie has her own telehealth practice. And it's just a really nice community to be a part of and share some information, and also get the free clinical content that we bring to you guys every week. The other thing I wanted to point out is all those breakdowns. So all those domains, those age distributions, how it's all broken down is reflected in our question bank. And research really shows that you don't need to be studying everything and waiting to the end to be taking those practice questions. Taking practice questions as you're studying the material is really helpful in helping you retain the information. In our question bank, we have over 1,600 questions that are broken down into those domains, and you can filter it by the board certification. So if you already know you're going to go ANP or ANCC, you can filter it so you get those different exam formats. And you can also filter it by subject lesson and those domains that we talked about by age. And so it's really helpful to know, okay, this is an assessment question. I need more help with assessment questions. I need more help with diagnostic questions. I need more help with evaluation plan. So it's really nice to be able to filter and focus on those knowledge gaps. That's where I really tell my students to be focusing their time when they're studying. It feels good to go and, take 25 practice questions in an area that you already know. You're like, okay, I'm going to do great. But that's not really going to serve you. And if you're on a timeline, you're getting ready to test, you really want to be filling in those knowledge gaps for yourself. In our practice questions, we give really detailed rationales, and we link you to our on-demand video so you can go right to that spot and watch the content that's related to that practice question. It's really, really great. We have over 1,600, over 16 hours of content. And actually, I think that's a little bit more because that's not counting our new advanced clinical skills videos that we've put on there this year, which are really, really great. We have full head to toe exams, neuro exams, how to use an otoscope, how to do a pelvic exam. They're really high quality, in-depth clinical advanced skill videos on there. And again, everything's broken down to bite sizes so you can really navigate it quickly, go to exactly what you want. And our question bank really leads you to that for those specific lessons. So it's really helpful to do both together at the same time. Our SurePass method really emphasizes watching videos, doing about 25 to 50 practice questions a day, and leaving it at that and really focusing on those knowledge gaps in those areas. So I really encourage you to check those products out. We also have a readiness predictor on our exam. So that will really give you a sense of, are you ready to sit for your board certification, or do you need to spend a little bit more time studying? So the data and the analytics are really, really helpful to see on our question bank with such high quality questions. I really enjoy it myself. And then the last thing I was going to say is, if you just feel like, I just don't know where to start. I've taken the exam and I've failed. I've done X, Y, and Z, and I just need some help. We do offer mentoring. I love mentoring our students. I work with you one-on-one, and I can really get you on a study plan that's going to feel good and help build or fill in those knowledge gaps. So if you just have a hard time of being like, well, Hiva, I don't know what my knowledge gaps are, so how can I focus my QBank questions on that? That's, I think, when mentoring is going to be a really beneficial thing for you. So even if it's just a few sessions just to get you on the right track, identify those knowledge gaps, and get you really focusing your study plan, it's going to be hugely beneficial. And as always, you guys can email me directly. I love hearing from students. I love hearing feedback. I get a lot of students asking me questions through email, a lot of students reaching out to me for mentoring, a lot of students also reaching out about our webinars. What did you like? What would you like to see more of? It's really nice to hear from you guys. So here at Archer, we do have a very positive and inclusive community, and I love that about my job, and I want to offer that to our students. So don't hesitate to reach out. That goes straight to me, and I answer every email personally. All right, you guys. So last thing I want to know is, after hearing what I had to say about these board certification exams, I want to hear what you have to say. So which exam are you planning on taking? I probably should have put in here, don't know yet. And this is my first time doing this webinar, so I'll make some tweaks for next time. But what do you guys think? Are you leaning more towards AANP, ANCC? Some students I've seen signing up for both. So I'm just curious about those in the audience today. I want to know, what are you guys thinking? I want to get a little pulse check. And what are you guys thinking about which board certification exam you're taking? So right now, kind of ANP and ANCC are head to head. Anybody thinking about taking both? Maybe not. Some typing. Okay, one person thinking about taking both. And my next question is, why? I want to know what goes into your decision making. So you've heard me do the overview of the two certification bodies. I want to know what went into your decision making and why you chose ANP or ANCC or both. So give me a little, this is an open text. You guys can just jot whatever you want down. So someone wrote both. Very good. So I want to know why. Why did you pick the one that you picked? Why do people take both? Yeah, that's a great question. So that person who wrote both, can you give us a little bit tip? And again, it's anonymous. So retake. So I think I do see that. I see some students signing up for both just because they want to give themselves options if they fail. And I think that's okay. But I think that also sets you up a little bit for failing because you're a little nervous about that, right? So you definitely think that, okay, I'm probably going to fail, so I'm going to give myself a backup option. So I don't know. I'm torn about that mindset, but I totally understand it. So there's no judgment. But if it were my student, I'd want to get you to the point where you're like, yeah, I'm going to walk into the board certification, I'm going to ace it, and I'm going to walk into my clinical practice and I'm going to take care of my patients. And I'm going to do a great job. And they are lucky to see me as a provider. And it's true. Being in clinical practice for as long as I have, I've seen a lot of good and a lot of not so good providers. And I'm not saying what their credentialing is. And it's not just NPs I'm talking about, it's across the board. And if you want to remain a good provider, you have to really continue to be a lifelong learner and also be humble about the things that you don't know and really be teaching yourself the things you don't know, and be humble with your patients, right? Spend the time with them to get to know them, to understand their needs. um, but you guys are so new. It's such a great place to be. It just happens as you're in practice for a long time. And that's one of my passions, of making sure those experienced clinicians don't get burned out and continue to keep that passion for the medicine that we went into for the first place, right? ANCC twice and didn't pass. Yeah. So I totally understand. So for employment status, you get nervous. You think, okay, I have to pass this so I can get the job that they've offered me. So I totally get that. And there's no judgment here. Well, thank you so much, you guys, for participating today. I know that was a short and sweet webinar. I hope you enjoyed it. I hope it was useful to you in really breaking down those two board certification exams. Again, I get this question a lot from my students, so I was really hoping that you guys would get something out of it and pass it along to your friends who are also thinking about taking their board certification and asking the same questions. I remember every time I would ask my faculty members, I wouldn't get a straight response either. And there was a lot of anxiety around, okay, which one am I going to pick? And there was a lot of peer pressure too, just going with the one that I saw a lot of my mentors and the people in those roles that I wanted with that particular credentialing. So that's the one that I went with. And now, being 10 years out, I realize it really does not matter, right? They're both credentialing bodies and you're going to be fine either way. Just look at the community that you want to be a part of long term, and either way, it'll be fine. You can always be part of both communities, whether you're credentialed with one or the other. For example, I'm going to the AANP conference this June, and it's already June, so I hope to see you guys there. And yeah, I hope you found this webinar helpful. Thank you so much for participating today. And let me know. Feel free to reach out to me if you have any questions. You guys have a wonderful rest of your day.